height, weight, BP. Okay, height, weight, ठीक है जी. Okay, fine. BP is not anthropometry. ठीक है जी. Okay, normal and abnormal. Very good. So basic thing is height and weight. ठीक है जी. Height and weight हमारे anthropometry दिए assess करता है. So height and weight. So আমাদের কয়েকটা standards আছে. এত height, এত weight. বাচ্চাদের standard, we have standards for children. We have standards for adults. Okay. Based on that, we have something called BMI or mass body index. Okay. So that is height and that is only applicable for adults. Okay. Now for small children, what we have is how do you assess a small child? For weight, to ठीक है जी, we have what is weighing machine. How will you assess a weighing machine of a 1-year-old child? Weight of a 1-year-old child? Huh? So এক বছর বাচ্চাকে দাঁড় করে দেবে। And what is the other option? Option না থাকলে? If there is no option of that, ওটা নেই, what will you do? No idea. You stand on this weighing machine. You stand. No. You stand with the shoes. You stand with the shoes. Okay, come out. Get out. Remove your shoes and stand. Remove your shoes and stand. No. She only. But how you assess it? How? So what was trying to tell you? Kole tule ekbar nawa, kole chhada. So that is if you don't have a weighing machine. Okay, that is one way. Second thing is two things are there. Mid-arm circumference. Okay, mid-arm circumference is certain parameters actually. So mid-arm circumference is a sign of in children is a sign depending on the age. Is a sign of health. Okay. Atota kam hole, the child is malnourished. And the length of this length is usually measured from here to here. Okay. From the graded trochanter to the olecranon process. That is the length for measuring the length of the limb. And mid-arms, from there you take the mid-arm circumference. So to know the mid-arm circumference, you should know from where to where. It's not from here to here. It's from mid-arm bolte eta. ठीक है जी. Tara half. That is the mid-arm circumference. So that again, that gives assessment of the protein energy malnutrition. Now you have certain other parameters. One is where you don't have facilities for all this. You have something called a bangle test. So you put your hand through a bangle. If it's green, that means the child is okay. If it is red, it means the child is malnourished. Red means the whole hand can go through the bangle. Green hole, it can't go, the child is malnourished. Then we have what we call a Shakir step. Shakir step আছে? Shakir step আছে কেন? Normal tape. So Shakir step anyway. দেখো। Okay, this is your tape. So we have another. This is normal tape. You have something called a Shakir step also. I'm not sure it's available here. नहीं मालूम. ठीक है. So what are you can measure it. Okay. So this gives identification of height and weight. Now that is important for knowing the protein energy malnutrition. So there are certain standards. You have ICMR standards, you have WHO standards, then you have various classification to assess whether somebody is malnourished or not. Like for example, you have the Indian childhood standards, then you have the Winslow classification, you have the Gomes classification, and now this is something which you can do any place, anytime, is anthropometry. And another thing in anthropometry, apart from height and weight, is we normally take the body mass index as a sign of obesity. But I can't say more than body mass index. What is the problem with body mass index? Or what is the formula for body mass index? Okay. So how many of you have studied maths since +2? You've studied maths. What about others? Maths Maths. So height in meters divided by height in meters divided by meter square. So square करता है प्रथम. Then divide it. Then it's so over 25, 30. Then it's obese, etc. What the thing is waist hip ratio. That's the easier way. Okay. Now what is waist and what is hip? Waist is not equal to hip. So what is the what is the ratio between waist and hip. Some people, they have what we call, I'm not body shaming, some people have a very slim thing. Some people have a more muscular body, whatever you like to, bulky body. So those are, now they're saying that is more important to know non-communicable disease like diabetes, hypertension. So if you have a waist-hip ratio which is high, you have a chance of getting diabetes, you have a chance of getting cardiovascular disease, you can get a chance of getting anything. So there's no square business. Waist divided by hip, that is the ratio. And there is that formula, that formula again is there, in which you will be able to predict whether this person can get non-communicable disease in the future. Okay? So this is the main thing. So again, now the question is regarding infants. The second year, no? Third year. So third year, gynec posting shuru hoyeche. Gynec posting shuru hoyeche. Pediatrics posting? Acha. Gynec pediatric posting shuru hoyeche. Okay. So there again, you have to measure the child and the infant. Okay, you have something. You have an infantometer hoyeche. देखा ना इन्फेंटोमेटर देखा अच्छा इन्फेंटोमेटर नहीं अच्छा ठीक है okay fine and that is called a stadiometer okay for measuring the height. So you have for infants you have infantometer for measuring the length and you have what is called crown drum length etc. And for children there are various formula 3 মাসে কত হয় 6 মাসে কত হয় এক বছরে weight triples at 2 years, that sort of thing, the birth weight. So you should know the birth weight also. ठीक है? This is more or less the thing of about anthropometry. Anthropometry uses the assessment of many things. Whether firstly in pediatrics, whether the child is malnourished or not, and whether the child needs to be given supplemental nutrition. In adulthood, it's a predictor of what disease you can get later on, like cardiovascular disease, diabetes, hypertension, etc. Okay, so don't take this anthropometry as lightly as it is. Let me say, okay, I'm slightly, my BMI is high and so on, so you're going to the gym, you'll be okay. It's not that going to the gym may be okay, but then if you come back from the gym and you come and have a lot of junk food and your things go up, so তাই জন্যে এটা ইয়ে করতে হবে. That anthropometry is one thing which in every field study you have anthropometry. Then another thing in anthropometry is which we normally discuss and we think about is anthropometry among boys and girls. You expect them to be different. Particularly puberty time, girls grow faster than boys in the start of puberty, but little later the boys catch up. So there are differences, and one of the biggest thing which I got regarding anthropometry is I won't forget my life. Is I was working in nearby Pakur, near in Jharkhand, just next to Murshidabad, next to our district also. In 2003 to 2008, sorry, 2003 to 2010, I was working for WHO. So we had an outbreak of polio in Pakur, and I was posted in Pakur just because I knew Bengali and I had served 7 years in Bihar and other places in Jharkhand. We had a meeting. There was a case over here in Murari, a block of Birmu. There was a case in Dhulian, and we didn't have any case that time. And our neighboring district was Murshidabad. So suddenly one patients used to come here looking for cases of acute flaccid paralysis. So if a patient has got acute flaccid paralysis, he may be having polio. So acute flaccid paralysis बोलते हैं हिंदी में लूज पूंछ टाइप का लकवा, but it should be sudden onset and flappy बोलते हैं हाथ तो लोग ये करते हैं, and paralysis. So paralysis, when we get the mind of paralysis, we see somebody is walking like this, we become like a feeling high. But so one patient came to. Many patients come. So our motor chilo, you take the stool for examination. Send the stool. I forgot about the case. So in the form, you have to measure measures the parts also. Okay. So measure the parts. Routine. তারপরে আমাকে আমার বস ফোন করে বললো, Dr. Menon, you remember this case know which case. I was in the field, he was also in the field. There's a call from Delhi. The case has turned to be positive. Do you remember the case? I said, I don't remember. I'm in the field, I can't remember all the cases. Then he said it's been positive, but we're not sure it's confirmed wild polio or not. It could be vaccine-derived polio also. Polio biology class হয়েছে? আচ্ছা, তখন তো কোথায় হয়েছে? মাইক্রোবায়োলজি, ঠিক আছে। তখন আমাদের বললো যে ঠিক আছে, অফিসে ফিরলাম, দেখলাম যে I looked at the file. The file was there. 5 বছর বাচ্চা, এখন আমার মোবাইলে ছবি আছে। বাচ্চাটা এসেছিল referred by Murshidabad unit, and I saw the patient. The only complaint was 0.5 centimeter difference in both arms. And not only that, the patient came after 14 days. 14 days মধ্যে stool নামার বেশি চান্স আছে। It came on 21 days, I still remember. তখন এই কেসটা পোলিও হবে, কি করে বলছেন পোলিও হবে? দেন কে এসছে, কোথেকে এসছে? মুর্শিদাবাদ ইউনিট এসছে, ফোন এসছে। দেন হোয়াট হ্যাপেন্ড ওয়াজ, এনিওয়ে একদিন পরে, সেই দিনই বিকেলে কনফার্ম দ্যাট ওয়াজ পোলিও। এবার পুরো হয়েছে, দিল্লি থেকে, জেনিভা থেকে সবাই মাথা চাটছে, হু স দিস কেস, এসব। তখন I had to go there again, ছবি নিলাম, পাঠালাম। তার আগে কিন্তু পেশেন্টটা এলো কি করে? মুর্শিদাবাদ ইউনিটে ফোন করলাম, কে ফোন করেছিল এই ব্যাপারে? মুর্শিদাবাদ ইউনিটের ও আবার খুঁজলো কে ফোন করেছিল। ওখানকার ফিল্ড ভলেন্টিয়ার একটা বিয়ে বাড়িতে গিয়েছিল। বিয়ের বাড়িতে গিয়ে ও নোট করেছে একটা বাচ্চার হাতটা একটু লুজ, একটু ডিফারেন্স আছে। তখন ও বললো, বাচ্চাটাকে জিজ্ঞেস করলো কেন, বাচ্চা মার সঙ্গে ছিল, কি হলো হাতে, কি হয়েছে, একটু কম মনে হচ্ছে। তো বাচ্চা মা কি জানি, আমি কি করে জানবো, বাড়ি কোথায়? বাড়ি হচ্ছে পাকুড়া। বিয়ে বাড়িতে গেছিল, ও ওইদিকে ছিল। তখন ও নোট করলো অ্যাড্রেস, ও পাঠিয়ে দিল এখানে। অ্যান্ড আমি যখন ফলো আপ করলাম, দিল্লির যখন টিম এসেছিল, বাচ্চাটা দৌড়চ্ছে, হাত তুলছে, সব বেবিফাই শেয়ার ক্লাস, আমাদের ফুল পোলিও ক্লাস যদি হয়, শেয়ার ফটোগ্রাফস এন্ড ভিডিও, আমার মোবাইল পেন ড্রাইভ আছে। তো আই ওয়াজ সারপ্রাইজ যে এক তো 21 দিন বাদে স্টুল স্যাম্পল গেছে, সেকেন্ডলি বাচ্চাটা পুরো হাত তুলছে, এইসব করছে, বাট only 0.5 centimeter difference in the 0.5, 1 centimeter, up to 0.5 is acceptable, কিন্তু আমার এতে 1 centimeter, তো 1 centimeter হতে পারে, বাট আনফর্চুনেটলি ওর স্টুলে পজিটিভ হয়েছে। দ্যাট ইজ দ্য ইম্পর্টেন্স অফ অ্যানথ্রোপোমেট্রি। মা বলেনি, মা কিছু বলেনি, কিন্তু ওই ফিল্ড ভলেন্টিয়ারটা বললো যে একটা হাত মনে হয় স্যার একটু আছে। আমি ফিল্ড ভলেন্টিয়ারকে চোখে দেখিনি, ইজ ইন মুর্শিদাবাদ, কিন্তু ওর মনে হলো যে একবার দিয়ে দিই, পাকুড়ে বাড়ি আছে, স্টুলটা নিয়ে নাও। That turned out positive, and that was the first case of polio আমাদের পাকুড়ে। And তারপরে 7টা কেস হলো, তারপরে eradicated polio in 2010, 2011 last case was in Howrah, তারপরে apparently ইন্ডিয়াতে খেলা শেষ। So the importance of anthropometry is not something that you can really move out. And anthropometry প্রচুর স্টাডিজ আছে, হাজার স্টাডিজ, anthropometry and various diseases, the connection with anthropometry and diabetes, anthropometry and Cushing syndrome, and so on and so forth. Okay.